Question 1. Which of the following statements regarding a DEA registration number is true for a prescriber? A. The first letter is always A or B. B. The second letter is the first letter of the prescriber's last name. C. It consists of 7 numbers followed by 2 letters. D. The sum of the first, third, and fifth digits, plus twice the sum of the second, fourth, and sixth digits, should have a last digit that matches the 7th digit. Answer D. The sum of the first, third, and fifth digits, plus twice the sum of the second, fourth, and sixth digits, should have a last digit that matches the 7th digit. This question tests knowledge of DEA number validation. A DEA registration number's validity can be checked using a specific mathematical formula involving the digits. While the first 2 letters provide information about the registrant, the calculation involving the digits is the most accurate and unique method for verifying its authenticity. Pharmacy technicians often verify DEA numbers to ensure legal prescription handling, especially for controlled substances. Question 2. A prescription calls for amoxicillin 250 mg per 5 ml, 150 mg POTID for 10 days. What is the total volume in ml that should be dispensed? A. 45 ml. B. 90 ml. C. 150 ml. D. 300 ml. Answer B. 90 ml. This question requires a multi-step calculation. First, determine the volume per dose. 150 mg/250 mg, asterisk 5 ml equals 3 ml per dose. Next, calculate the total daily volume. 3 ml per dose, asterisk 3 doses/day equals 9 ml per day. Finally, multiply by the duration. 9 ml per day, asterisk 10 days equals 90 ml total. Accurate dosage calculations are critical for patient safety, preventing both underdosing and overdosing, and technicians must master these skills. Question 3. Which of the following medications must be stored in the refrigerator between 2 degrees Celsius and 8 degrees Celsius, 36 degrees F and 46 degrees Fahrenheit? A. Synthroid, levothyroxine. B. Lantus, insulin glargine. C. Lipitor, atorvastatin. D. Zithromax, azithromycin, oral suspension, after reconstitution. Answer B. Lantus, insulin glargine. This question tests knowledge of specific medication storage requirements, which is crucial for maintaining drug efficacy and safety. Insulin products like Lantus Anopinidi are typically stored in the refrigerator before use to extend their shelf life. While reconstituted Zithromax also requires refrigeration, Lantus is a primary example of a medication consistently needing cold storage to preserve its potency. Proper storage protocols prevent drug degradation and ensure patients receive effective therapy. Question 4. To minimize errors with lookalike/soundalike medications, which strategy is most effective for a pharmacy technician? A. Storing them alphabetically on the same shelf. B. Using tall man lettering for drug names. C. Relying solely on the prescribing physician's handwriting. D. Dispensing based only on the brand name. Answer B. Using tall man lettering for drug names. Tall man lettering is a proven strategy to differentiate lookalike/soundalike drug names, e.g., bupropion versus buspirone, by capitalizing dissimilar parts of the names. Storing similar-sounding drugs together increases the risk of error, and relying on handwriting or brand name alone doesn't address the core issue of visual or auditory confusion. Implementing such safeguards is vital for patient safety and reducing medication errors in the pharmacy. Question 5. A pharmacy technician receives a phone call requesting patient information from someone claiming to be the patient's spouse. What is the most appropriate action for the technician to take under HIPAA guidelines? A. Provide the information, as spouses are typically authorized. B. Ask for a password or secret question to verify identity. C. Inform the caller that patient information cannot be released without proper authorization. D. Transfer the call to the pharmacist to handle. Answer C. Inform the caller that patient information cannot be released without proper authorization. Under HIPAA, patient health information is protected, and it cannot be released to anyone, including family members, without the patient's explicit authorization on file or verification of their identity and relationship. The most appropriate action is to state that information cannot be released without proper authorization, ensuring patient privacy is maintained. Technicians must understand and strictly adhere to HIPAA regulations to protect patient confidentiality. Question 6. Which of the following components is not legally required on a prescription for a non-controlled substance? A. Prescriber's DEA number. B. Patient's full name. C. Date written. D. Drug name and strength. Answer: A. Prescriber's DEA number. While a prescriber's DEA number is mandatory for controlled substance prescriptions, it is not a legal requirement for non-controlled substances. Essential components for all prescriptions include the patient's name, date, drug name and strength, dosage form, quantity, directions for use, and prescriber's signature. Knowing these legal requirements helps technicians identify incomplete or invalid prescriptions and prevents dispensing errors. Question 7. Which of the following medications is classified as a high-alert medication due to its narrow therapeutic index and potential for significant patient harm if misused? A. Ibuprofen. B. Digoxin. C. Furosemide. D. Metformin. Answer: B. Digoxin. High-alert medications are drugs that bear a heightened risk of causing significant patient harm when used in error. Digoxin, with its narrow therapeutic index, is a classic example where small dosing errors can lead to serious toxicity or ineffective treatment. Identifying and handling high-alert medications with extra caution, often involving double checks, is a critical patient safety practice in pharmacy. Question 8. What does PAR level refer to in pharmacy inventory management? A. The amount of medication to be ordered from a supplier. B. The maximum quantity of a specific drug that should be on hand at any given time. C. The minimum quantity of a specific drug that should be on hand before reordering. D. The average daily usage of a particular medication. Answer: C. The minimum quantity of a specific drug that should be on hand before reordering. PAR level, periodic automatic replacement, or reorder point, is the designated minimum quantity of a specific drug that should be available in the pharmacy stock before a new order is placed. When the inventory drops to or below this level, it signals the need to replenish the stock to avoid running out. Efficient inventory management using PAR levels ensures that medications are always available for patients while minimizing waste and overstocking. Question 9. According to USP less than 797 guidelines, what is the maximum beyond use date, BUD, for a sterile compounded non-aqueous preparation stored at controlled room temperature if stability data is not available? A. 14 days. B. 30 days. C. 6 months. D. 1 year. Answer: C. 6 months. USP less than 797 provides specific guidelines for assigning beyond use dates, but for compounded sterile preparations to ensure their sterility and potency. For non-aqueous compounded sterile preparations, if no specific stability data is available, the maximum BUD is 6 months when stored at controlled room temperature. Adhering to these BUD guidelines is crucial for patient safety, preventing the use of degraded or contaminated compounded products. Question 10. A patient is prescribed lisinopril for hypertension. To which drug class does lisinopril belong? A. Beta blocker. B. Calcium channel blocker. C. Angiotensin-converting enzyme, ACE, inhibitor. D. Diuretic. Answer: C. Angiotensin-converting enzyme, ACE, inhibitor. Lisinopril is a commonly prescribed medication for hypertension and heart failure. Its mechanism of action involves inhibiting the angiotensin-converting enzyme, classifying it as an ACE inhibitor. Pharmacy technicians must be familiar with common drug classes and their corresponding medications to understand their use, potential interactions, and to answer basic patient questions under the pharmacist's supervision. Question 11. How many refills are permitted for a Schedule II controlled substance prescription? A. 0. B. 1. C. 3. D. 5. Answer: A. 0. Schedule II controlled substances, such as oxycodone or Adderall, are strictly regulated due to their high potential for abuse and dependence. Federal law dictates that prescriptions for Schedule II drugs cannot be refilled. A new prescription must be issued each time. Understanding these regulations is critical for pharmacy technicians to ensure legal compliance and prevent diversion of controlled substances. Question 12. What does DA1 on a prescription signify in terms of dispensing? A. Dispense as written, substitution permitted. B. Dispense as written, brand medically necessary. C. Dispense as written, patient requested brand. D. Dispense as written, no substitution allowed by prescriber. Answer: D. Dispense as written, no substitution allowed by prescriber. The dispense as written NA codes are used in prescription processing to indicate whether a generic substitution is permitted. DA1 specifically means that the prescriber explicitly indicated that no substitution is allowed, requiring the dispensing of the brand name product. Correctly interpreting and applying DA codes is essential for accurate prescription fulfillment and appropriate billing. Question 13. How many grams of pure drug are in 250 milliliters of a 0.9% with V sodium chloride solution? A. 0.9 g. B. 2.25 g. C. 9 g. D. 22.5 g. Answer: B. 2.25 g. A 0.9% with V solution means there are 0.9 grams of drug per 100 milliliters of solution. To find the amount of drug in 250 milliliters, set up a proportion. 0.9 g/100 milliliters equals xg/250 milliliters. Solving for x gives x equals 0.9 * 250/100 is equal to 2.25 grams. Understanding percent strength calculations is fundamental for compounding and preparing various pharmaceutical solutions accurately. Question 14. USP less than 800 guidelines primarily focus on the safe handling of which type of medications? A. Sterile compounded preparations. B. Non-sterile compounded preparations. C. Hazardous drugs. D. Over-the-counter medications. Answer: C. Hazardous drugs. USP less than 800 provides standards for the handling of hazardous drugs in healthcare settings to promote patient safety, worker safety, and environmental protection. It covers all aspects from receipt and storage to compounding, administration, and disposal. Pharmacy technicians involved in handling hazardous medications must be fully compliant with USP less than 800 to mitigate risks associated with exposure. Question 15. Which route of administration involves placing a medication under the tongue for absorption into the bloodstream? A. Oral. B. Sublingual. C. Buccal. D. Topical. Answer: B. Sublingual. Sublingual administration involves placing the medication under the tongue, allowing it to dissolve and be absorbed directly into the bloodstream through the mucous membranes, bypassing the digestive system and liver metabolism. This route is often used for rapid onset of action. Knowing different routes of administration is crucial for understanding drug action and counseling patients on proper medication use. Question 16. The Poison Prevention Packaging Act, PPPA, requires most prescription drugs to be dispensed in child-resistant containers. Which of the following is a common exception to this rule? A. Antibiotics. B. Oral contraceptives. C. Antidepressants. D. Blood pressure medications. Answer: B. Oral contraceptives. The Poison Prevention Packaging Act, PPPA, mandates child-resistant packaging for most prescription and certain over-the-counter drugs to prevent accidental ingestion by children. However, some medications, such as oral contraceptives, sublingual nitroglycerin, and certain steroid doses, are specifically exempt due to patient access needs or packaging considerations. Technicians must be aware of these exceptions for proper dispensing. Question 17. A prescription is written for Synthroid 100 micrograms, number 90 sig. 1 tablet daily. What is the day supply for this prescription? A. 30 days. B. 60 days. C. 90 days. D. 180 days. Answer C. 90 days. To calculate the day's supply, divide the total quantity dispensed by the daily dose. In this case, 90 tablets/1 tablet per day equals 90 days. Accurate calculation of day supply is essential for patient compliance, insurance billing, and identifying potential discrepancies or early refills. Question 18. What does the SIG code GTTS OBID on a prescription mean? A. 2 drops in the left ear daily. B. 2 drops in the right eye twice a day. C. Drops in both ears twice a day. D. Drops in both eyes twice a day. Answer C. Drops in both ears twice a day. Understanding Latin abbreviations and SIG codes is fundamental for interpreting prescriptions accurately. GTTS means drops, O means both ears, and BID means twice a day. Therefore, GTTS OBID translates to drops in both ears twice a day. Misinterpreting SIG codes can lead to medication errors, highlighting the importance of thorough knowledge for technicians. Question 19. If a pharmacy technician identifies a potential medication error before dispensing, what is the most appropriate immediate action? A. Dispense the medication and note the potential error for later review. B. Inform the patient about the error. C. Report the error to the pharmacist and stop the dispensing process. D. Correct the error silently and proceed with dispensing. Answer C. Report the error to the pharmacist and stop the dispensing process. Upon identifying a potential medication error, the most critical immediate action is to stop the dispensing process and report it to the supervising pharmacist. This allows for immediate correction and prevents patient harm. Patient safety is paramount, and open communication about errors is essential for a safe pharmacy environment. Question 20. The abbreviation PRN on a prescription indicates that the medication should be taken. A. At bedtime. B. As needed. C. Immediately. D. By mouth. Answer B. As needed. PRN is a common Latin abbreviation meaning pro re nata, which translates to as needed. This instruction allows the patient to take the medication only when they experience specific symptoms or conditions, rather than on a fixed schedule. Proper understanding of such abbreviations is crucial for accurate dispensing and patient counseling. Question 21. Some medications require a risk evaluation and mitigation strategy (REMS) program due to their significant risks. Which entity mandates REMS programs? A. Drug Enforcement Administration, D. B. Food and Drug Administration, FDA. C. National Association of Boards of Pharmacy, NABP. D. The Joint Commission, TC. Answer B. Food and Drug Administration, FDA. The Food and Drug Administration, FDA, has the authority to require a risk evaluation and mitigation strategy, REMS, for certain medications with serious safety concerns to ensure that the benefits of the drug outweigh its risks. REMS programs can include elements like special training for prescribers, patient registries, or restricted distribution. Pharmacy technicians may be involved in specific steps of REMS programs, making this knowledge essential. Question 22. A physician orders an 4 infusion of 1,000 milliliters of D5W to be administered over 8 hours. The 4 tubing delivers 15 GTTS/ml. What is the flow rate in GTTS/min? A. 21 GTTS/min. B. 31 GTTS/min. C. 60 GTTS/min. D. 125 GTTS/min. Answer B. 31 GTTS/min. First, convert total time to minutes. 8 hours *60 minutes/hour equals 480 minutes. Next, use the formula volume in ml asterisk drop factor slash time in minutes. So 1000 ml asterisk 15 GTTS slash ml slash 480 minutes equals 15,000 slash 480 is equal to 31.25 GTTS slash min. Rounding to the nearest whole number gives 31 GTTS slash min. Accurate flow rate calculations are vital in hospital and infusion pharmacy settings to ensure proper drug delivery. Question 23. Which piece of equipment is primarily used to measure the volume of liquids accurately in non-sterile compounding? A. Mortar and pestle. B. Torsion balance. C. Graduated cylinder. D. Spatula. Answer C. Graduated cylinder. A graduated cylinder is the most appropriate and accurate piece of equipment for measuring liquid volumes in non-sterile compounding. A mortar and pestle are used for grinding solids, a torsion balance for weighing substances, and a spatula for transferring materials. Selecting the correct equipment is fundamental to ensuring the accuracy and quality of compounded preparations. Question 24. Which of the following is a characteristic of Schedule 5 controlled substances? A. High potential for abuse, no accepted medical use. B. High potential for abuse, severe psychological or physical dependence. C. Less potential for abuse than Schedule 4, limited physical or psychological dependence. D. Low potential for abuse, contains limited quantities of certain narcotics. Some may be purchased OTC in specific states. Answer D. Low potential for abuse, contains limited quantities of certain narcotics. Some may be purchased OTC in specific states. Schedule 5 controlled substances have the lowest potential for abuse among the scheduled drugs, containing limited quantities of certain narcotics, often for antitussive, antidiarrheal, and analgesic purposes. In some states, certain Schedule 5 medications can be purchased over-the-counter with specific record-keeping requirements. Understanding the characteristics of each controlled substance schedule is crucial for proper handling and dispensing. Question 25. Medication reconciliation is the process of comparing a patient's current medication list against newly ordered medications. When is this process typically performed? A. Only upon patient discharge from a hospital. B. Only during annual physical exams. C. At transitions of care, such as admission, transfer, and discharge. D. Only when a patient reports an adverse drug reaction. Answer C. At transitions of care, such as admission, transfer, and discharge. Medication reconciliation is a critical patient safety process performed at all transitions of care, for example, admission to a hospital, transfer between units, and discharge to prevent medication errors like omissions, duplications, dosing errors, and drug interactions. This systematic review ensures the accuracy and completeness of a patient's medication list. Pharmacy technicians often assist in gathering and documenting medication histories for reconciliation. Question 26. In pharmacy inventory management, what does the FIFO method primarily aim to achieve? A. To keep the most expensive drugs in the front of the shelf. B. To ensure that older stock is used before newer stock. C. To rotate stock based on alphabetical order. D. To minimize the amount of medication stored in the pharmacy. Answer B. To ensure that older stock is used before newer stock. FIFO stands for First In, First Out. This inventory management principle ensures that medications with earlier expiration dates, or those received first, are dispensed before newer stock. Implementing FIFO helps prevent waste due to expired drugs and ensures that patients receive medications that are still within their potency period. This practice is essential for maintaining product quality and reducing financial loss from spoilage. Question 27. The Omnibus Budget Reconciliation Act of 1990, OBRA 90, primarily mandates which of the following for pharmacists? A. To maintain specific inventory levels for all drugs. B. To provide patient counseling for all Medicaid patients. C. To conduct annual continuing education on controlled substances. D. To dispense only generic medications when available. Answer B. To provide patient counseling for all Medicaid patients. OBRA 90 requires pharmacists to offer prospective drug utilization review, DUR, and patient counseling for all Medicaid patients. This act aimed to improve the quality of drug therapy and patient outcomes by ensuring patients receive appropriate information about their medications. While it specifically targets Medicaid, the practice of counseling has become a standard of care for all patients in most pharmacy settings. Question 28. Which action is an essential component of maintaining aseptic technique in a laminar airflow workbench, IFW, during sterile compounding? A. Wiping down the work surface with isopropyl alcohol after each batch. B. Blocking the first air with hands or supplies. C. Performing all manipulations at least 3 inches inside the IFW. D. Reusing gloves between different compounding preparations. Answer: C. Performing all manipulations at least 3 inches inside the IFW. Maintaining aseptic technique is paramount in sterile compounding to prevent contamination. Performing all manipulations at least 3 inches inside the IFW ensures that operations occur within the first air or critical zone, where filtered air is uninterrupted, minimizing contamination risk. Blocking first air, reusing gloves, or only cleaning after batches are all practices that compromise sterility. Proper technique is vital for patient safety. Question 29. Which of the following is a common side effect associated with opioid pain medications? A. Diarrhea. B. Constipation. C. Insomnia. D. Hypertension. Answer: B. Constipation. Opioid pain medications are well known to cause significant constipation due to their effect on gastrointestinal motility by slowing down the movement of stool through the intestines. Patients taking opioids are often advised on strategies to manage this common side effect, such as increased fiber intake or stool softeners. Technicians should be aware of common drug side effects to assist pharmacists in patient counseling. Question 30. A pharmacy needs to prepare 500 milliliters of a 20% dextrose solution. They have 70% dextrose solution and 5% dextrose solution available. How much of the 70% dextrose solution is needed? A. 115.38 ml. B. 142.86 ml. C. 192.31 ml. D. 238.10 ml. Answer: A. 115.38 ml. This problem requires the use of alligation to determine the amounts of 2 different concentrations needed to achieve a desired concentration and total volume. Set up the alligation grid. Desired potency lower conci equals 20% 5% equals 15 parts for the higher 70% solution, and higher potency desired conci equals 70% 20% equals 50 parts for the lower 5% solution. The total parts are 15 plus 50 is equal to 65. To find the volume of 70% solution, calculate 15 parts / 65 total parts, asterisk 500 milliliters equals 115.38 ml. Alligation is a crucial skill for compounding technicians to accurately prepare solutions of various strengths. Question 31. Which DEA form is used by pharmacies to order Schedule II controlled substances? A. DEA Form 106. B. DEA Form 222. C. DEA Form 41. D. DEA Form 224. Answer: B. DEA Form 222. DEA Form 222 is the specific official document required for ordering Schedule II controlled substances. It is a triplicate form, meticulously tracked by the DEA, to ensure strict accountability for these highly controlled drugs. Pharmacy technicians are often responsible for preparing and maintaining these forms under the pharmacist's supervision, making knowledge of this form essential for legal compliance and preventing drug diversion. Question 32. What is the primary difference between a beyond use date, BUD, and an expiration date? A. Expiration dates apply only to sterile products, while BUDs apply to non-sterile products. B. Expiration dates are set by the manufacturer, while BUDs are assigned by the compounding pharmacy. C. Buds indicate sterility, while expiration dates indicate potency. D. There is no significant difference. The terms are interchangeable. Answer B. Expiration dates are set by the manufacturer, while buds are assigned by the compounding pharmacy. The expiration date is determined by the manufacturer based on stability studies of the original commercial product, indicating the period during which the product is expected to remain stable, potent, and sterile. A beyond-use date, BUD, on the other hand, is assigned by the pharmacy for compounded preparations or multi-dose vials after they have been opened or manipulated, indicating the date after which the preparation should not be used. Understanding this distinction is vital for maintaining drug efficacy and patient safety in compounding. Question 33. A patient's prescription is rejected by insurance with a message, "Prior authorization required." What does this typically mean? A. The patient's insurance coverage has expired. B. The medication is not covered by the patient's plan. C. The prescriber needs to justify the medical necessity of the drug to the insurance company before it can be covered. D. The pharmacy needs to submit additional billing information to the insurance. Answer C. The prescriber needs to justify the medical necessity of the drug to the insurance company before it can be covered. A prior authorization required message from insurance means that the medication, although potentially covered, requires a review and approval from the insurance company based on medical necessity before it can be dispensed and reimbursed. The prescriber typically submits the necessary documentation to justify its use. Pharmacy technicians often facilitate this process by contacting the prescriber's office and assisting with the required paperwork. Question 34. A prescriber writes a prescription for brand X and does not indicate dispense as written. The pharmacy has a therapeutically equivalent generic available. What is the usual procedure? A. Dispense brand X as written, as the brand name was specified. B. Contact the prescriber for clarification on generic substitution. C. Dispense the generic equivalent, assuming state laws permit substitution. D. Dispense the generic, but charge the patient for the brand name. Answer C. Dispense the generic equivalent, assuming state laws permit substitution. In most states, if a prescriber writes for a brand name medication without specifically indicating dispense as written, e.g., by a DA code or handwritten instruction, and a therapeutically equivalent generic is available, the pharmacy is legally permitted and often encouraged to dispense the generic. This practice promotes cost savings for both the patient and the healthcare system. Technicians should be aware of state-specific generic substitution laws and pharmacy policies to ensure correct dispensing. Question 35. The Institute for Safe Medication Practices, ISMP, advocates for the use of independent double checks for high-alert medications. What is the primary purpose of an independent double check? A. To speed up the dispensing process in busy pharmacies. B. To allow two technicians to verify the same prescription. C. To have a second healthcare professional independently review the medication order and preparation to catch potential errors. D. To provide an opportunity for patient counseling before dispensing. Answer C. To have a second healthcare professional independently review the medication order and preparation to catch potential errors. An independent double check involves a second, unbiased healthcare professional separately reviewing a medication order and its preparation or administration, without being influenced by the first person's assessment. This crucial patient safety strategy is particularly recommended for high-alert medications and aims to catch errors that a single person might miss, thereby significantly reducing the risk of harm. Pharmacy technicians often perform initial checks, with pharmacists performing independent final verification.